Camera's on. Doesn't matter.
Oh, this is a video.
So being a pharmacist, I realized that I noticed that a lot of time, generally speaking, patient doesn't really get enough time to spend with even with the doctor, with the nurse, or even with the pharmacist. They never get that time to have things explained to them about their medicine or about their health condition or about their disease. So I kind of decided to, just take the time off and share that some of the information that I know. Hopefully it will help you. This is not by any mean, medical consultation, or that's not by any mean medical advice. So if you have any trouble, any problem, you should talk to your doctor. Right?
And you shouldn't get scared.
Yep. You're not going to rely on a video for that. So today we're going to talk about asthma. Actually, being a pharmacist, I notice a lot of patients don't get a lot of information about their asthma, or they lack very important information about their asthma, either because they never sat down with the doctor or the healthcare provider and get the information they needed about their medicine, or they just never had the time to review this information. I'm going to talk about some of the important information about asthma medicine. I'm not going to talk about diagnosis or symptoms of the disease or anything like that, because you should be already, if you're watching this video, you either have a confirmed case of asthma, you're living with asthma, or you know somebody who has asthma, or you're just curious to know about asthma medication. So if you have asthma, you're definitely on one of these medication, either Ventolin, PROAIR, or PROVENTAL. They call it rescue inhaler or quick reliever. They're basically a beta-2 agonist, so they call it beta-2 selective agonist. So what happens, this drug works on the beta receptors in the airway, so it opens up the airway a little bit and help with the breathing. But keep in mind, these are not controller. They don't treat the asthma, they just treat the symptoms, right? So you don't want to use that more often. So I think we're going to talk about the guidelines. I think they don't recommend more than twice a week. These are the rescue inhaler. There is a generic Ventolin available. The only thing with PROVENTAL, it doesn't have a dose counter. So when it doesn't have a counter, you wouldn't know if you run out of doses or not. And the worst thing that happens, you get up in the middle of the night and you have this exacerbation. You're reaching out for the PROVENTAL and there's nothing left in it. So the advantage of the other inhalers, they have the counters, so you will be able to track how many doses left. You don't want to just be in the dark where you don't know if it's half full, it's empty, if it's full. So keep an eye on that. The other thing you want to do also to keep it clean, a lot of patients come to me and says, hey, this is not working, it's broken, it doesn't deliver any doses. But it's perfectly fine. It has a lot of medication, but the problem is when you use it's a suspension, so it's a thick solution. So be careful when that inhaler sits on the shelf or sits in your bathroom cabinet for a few weeks and not using it. When you try to reach out to it and use it, it's probably clogged because of that suspension. Get into the mouthpiece and block it. So what you need to do is just remove that canister that has the drug and run that mouthpiece under warm water for a few minutes, and it will clean it and you'll be able to use it. So just keep an eye and make sure it's clean. And that is why you usually have this medication only as needed, and then you're going to be taking another medicine like maybe Advair or PROVENTAL, and we're going to talk more in details about that on daily basis, which is basically steroids that you take. It's a topical steroid, so it shouldn't have that bad side effect about the steroids. So you're going to take that controllers every day to use the as needed inhaler less and less. I notice in some cases people will have a viral infection like get the flu, and then now they're coughing, right? So some doctors will give him the PROVENTAL or Ventolin plus one of the steroid inhaler, which it doesn't work, and we're going to talk about that. Also, I've noticed some patients with asthma, they start coughing, and then if you're coughing because of the asthma, or if you have asthma and now you're coughing, do yourself a favor. Please don't go to the doctor or the pharmacy and ask them for what is good over the counter, because there'll be nothing good over the counter for your case. If you want to try Robitussin or Mucinex or anything like that over the counter, I'm going to tell you right now, it's not going to work. Because the cough that you have is just, it's because of the symptoms. It's a symptoms because of your asthma, and you need to control that. So what you should be doing is taking that inhaler that we talked about it to relieve the exacerbation or the symptoms. But keep in mind, this is only going to work on the airway. It's not going to treat the inflammation. So you're going to get 80 to 90% or maybe less of your symptoms control, because you're still gonna need to treat the inflammation. Remember, the Ventolin, PROAIR, or PROVENTAL, they do not treat the inflammation. They only relax the airways, so they help you breathe. So what's going to treat the inflammation is a short course of steroids. They usually give prednisone or prednisolone. Here's the difference between both. Prednisone is a prodrug. Prednisone is not active drug. Your body has to convert that to prednisolone to be effective. Do yourself a favor and take that prednisone in the morning, or like noontime. I wouldn't take it at bedtime. If you do, you're probably going to be awake all night. Usually doctors will give only 5 days treatment to manage that acute symptoms or acute exacerbation of asthma. That could include cough. I know some of you will be like, no, I don't want to take steroids. They're bad. They're going to make me gain weight, and they're going to increase my appetite, and they're going to give me that moon face. I'm going to be diabetic and I'm going to have all kind of terrible side effects because of it. But here's the thing. All the side effect that you are talking about it is based on duration. So if you're going to be taking this drug for an extended period of time, then yes, you're going to have all that kind of problem. But if you're going to only take it for 5 days, none of it's going to happen. Maybe the appetite will increase a little bit for people who are already overweight, but generally speaking, you shouldn't have any of the side effect for if you're going to take it for 5 days. Keep in mind, you're taking it to help you breathe. So if you don't want to take it just because you're afraid that you're probably going to gain weight, you're not going to be able to breathe. Some doctors who manage patients with asthma, they give him a script for prednisone only for 5 days just to keep that handy. The reason why they do that, because like I said, if you're asthmatic and you're coughing and you're trying to get something over the counter, I'm going to tell you right now, save your money. Nothing over the counter is going to work for your cough, because that cough is not because of cold. That cough is because of you got some inflammation going on in your lung that need to be treated. So some doctor, they give you like a prescription for 5 days for prednisone or prednisolone, and we talked about the difference, to keep it handy just in case you have that exacerbation. So instead of going over the counter and messing around with the product that is not going to work for you, you just go ahead and fill that prescription. I'm going to tell you why this is important, because if you don't have that prescription handy and you're already an asthmatic patient, what's going to happen is you're going to spend money over the counter for a product that is not going to work, and you're going to end up going to the hospital. If you're going to go to the hospital or ER, you're going to spend couple $1,000 to get a prescription for a drug that costs $4. So ask your doctor to have that prescription handy, to save yourself. Use for the rescue inhaler, or some doctor will prescribe it to block the exercise-induced asthma or exercise-induced bronchospasm. So what happens is when you run or exercise, for the normal patient who does not have an asthma, when they inhale the air, it becomes moistened and warm. But in an asthma patient, because of that hyperosmolar environment, that doesn't happen. So what happens is that air triggers the symptoms, right, of the asthma. What happened is these mast cells had mediators like, histamine and leukotrienes. So what we're trying to do here for the asthma patient is to keep these mediators inside the mast cells. So luckily, the mast cell has a beta receptor. So when you inhale, it's like when you give you like 1 dose of Ventolin or PROVENTAL like half an hour before you exercise. So it works actually on the beta receptors on the mast cell and kind of prevent the production of these mediators from the mast cell. And when you go ahead and exercise, it will hopefully prevent the symptoms. Next time we're going to talk more about the different type of inhalers, which one we should start with, the difference between the solution for the nebulizer and the inhaler, the MDI, or you guys call it the puffer. We're also going to talk about different kind of the air chamber and spacer. Should we use them? Should we not use them? Which one is better than the other? And so forth. So stay tuned.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk. What was that all about?
And yes, the proper technique of using the inhaler.